Yeah. Hello, everyone. I welcome you to the today's session of how to manage COVID positive patients in late pregnancy by Apollo Cradle. To speak on this topic today, I would like to welcome Dr. Radha Rao. She's our in-house senior consultant as obstetrician and gynecologist working with Jayanagar Center of Apollo Hospitals. She's done her MBBS, MS into gynecology, and she's also done her MD there. Doctor, welcome on this session. We are looking forward to hear from you on how to manage these such critical situations in pregnancy. All yours, ma'am. And as and when question comes, I'll forward it to you. Thank you.
Thanks a lot, Aarti. A very warm welcome to all of you who are watching this. Yes, yeah. So I would like to share a bit of information with all of you about the topic for today, which is COVID positivity in pregnancy. As you know, Omicron wave is just looking like it is coming down now. And if this talk had been 2 weeks previously, 2 weeks before today, we would have been at the height of the third wave, and we were getting a lot of positive cases. And thank God the cases are coming down now in Bangalore. So we'll start the topic with somebody receiving a positive COVID test. So you could be in the first trimester, second trimester, or third trimester. I think the first thing that patients do is they panic. So though we have been very reassuring about the COVID being mild this time, most patients, they are very concerned about this. And so what should one do? As you know, COVID is it's a viral disease, and it causes symptoms such as fever, sore throat, headache, sometimes body ache, and it can also person gets these symptoms in the first trimester. That means what I mean by first trimester is from the start of pregnancy to about 12 weeks. And then the second trimester is from 12 weeks to about 28 weeks, that is up to the seventh month. And then the third trimester is from seventh month up to the time of delivery, which is usually about 9 months. So, first trimester, if somebody is positive, the usual concerns are, is it okay to continue the pregnancy? And some people ask, will it affect the baby? So, one very reassuring thing I have to say is, so far in all the research and the papers that have been published, COVID has not been known to be associated with any form of congenital malformations. Of course, the long term effects are yet to be seen, but so far we can be quite reassuring. And being COVID positive in the first trimester is not an indication to terminate the pregnancy solely because of having had a COVID infection. And also, the medicines that are normally given for COVID, I mean, we only prescribe paracetamol and antihistamines in the first trimester. Second trimester, usually no issues. So you have your normal scans. And in the third trimester, that is when you're close to delivery, there are two ways you might get it. One is you are tested because you're coming in for a delivery, and routine testing of COVID has been done in all the hospitals so far. The good news is most of the hospitals, including Apollo Cradle, has stopped routine testing for COVID prior to admission. Either you come as an emergency or for an elective cesarean section or an elective delivery. We have stopped testing. So if you are found to be, we would do a test if you are symptomatic. If you have fever, if you have cough, if you have a running nose, headache, any symptom suggestive of COVID, we would test you. So if you are positive or you have been positive in the past, what should you do? Suppose you are close to delivery or you're close contact is positive, or you've just met somebody and they call you back and say, I've been tested positive. One thing is, do not panic. One thing is, do not panic. Take your time. wave, Omicron virus, Omicron variant of the COVID virus, though it is more infectious, that means to say it's more likely you will get it if you have been in touch with somebody who has had COVID. The severity is less. Definitely, it is less than the last wave. And this time also, it can be mild symptoms where you just have mild cough, fever, as I said, or moderate symptoms where you cough a little more, you get a little breathless, and you check your saturation at home, it is approaching around 90 to 94%, and you start breathing a little fast, or severe and critical kind of COVID, that is, you're short of breath, you cough so much, and you have to get admitted to the hospital, and you're in the high dependency unit or the ICU, and these are quite rare. The chance of somebody getting severe COVID in this wave has been exceptionally less. This is throughout the world. And one important thing is, a pregnant woman, is she more prone to get COVID than a non-pregnant person? No, she's just at risk as any other normal person, and the symptoms are also pretty much the same. And if a woman is approaching her delivery, if you are usually around 36, 37 weeks, one option is to wait and for about 7 to 10 days while the COVID positivity and the illness goes away from you. So that would take about 7 to 10 days, and we monitor the baby. So that could be by fetal movement charts. So you take the baby movements at home. You can check your blood pressure, blood sugar if required, and that way you manage through the whole COVID scenario. And once you're at the other end of it, we can plan your delivery, whether it is vaginal delivery or C-section. Just because you're COVID positive, even in late pregnancy, it does not mean that you just have to deliver the baby. So, and also, if you come in labor and you are already positive, we would manage you like if you are in a place that caters for COVID positive patients. You can also have one attender with you, your spouse, your partner, but that person should be COVID negative. And the staff will take special care. They will wear PPE equipment, and you will be cared for just like as if you're in labor at any other time, including routine vaginal examinations. They will not expedite your labor or anything like that. Of course, if you get fever or if you get signs of shortness of breath, then a medical call has to be taken, whether whether you need to we need to do a cesarean section or not. For any reason, if cesarean section is required, then the OT will be prepped for a case of COVID positive C-section. So everybody will be in PPE kits, and the anesthesia given is generally spinal or epidural or a combined anesthesia. Usually, general anesthetic is avoided, especially in a person who has a COVID positive patient. It can disperse the virus more, and the staff are at risk. They will have to wear protective equipment. But as a patient, I think all you can do is in labor, just go through the how you had final stages of delivery. We would take further precautions to avoid droplets dropping out and infecting other staff. So they will also be in a PPE equipment. And of course, your partner can be with you, who will also be in a PPE suit. We do limit visitation, and if the hospital deems it necessary, the visitors who will see you in hospital will be very much minimized. So, coming to transmission to the baby, so we will alert the pediatrician that you have been COVID positive, and it's possible that they do a test for the baby. But the transfer through the placenta, that is, while the baby is inside your womb, is very minimal. It could happen because of you holding the baby, because of your respiratory secretions and droplet infection. But through the placenta or through the vaginal secretions, like it happens in other infections, we would not expect it has not been established that COVID transmits that way into the baby. And you can breastfeed the baby, but when you're not breastfeeding, baby should be at least 6 feet away or in a separate room. And when you're breastfeeding, you should look after your hand hygiene, wear a mask, breastfeed the baby. You can even express and ask another person to give milk to the baby, but breastfeeding can be done. Certain precautions have to be taken. In certain situations, we do advise that there should be a bit of separation between the mother and the baby in exceptional situations, but most of the time, taking certain precautions, breastfeeding can also be done. So, as I said, plus the transfer of COVID has been noted in certain cases from the mother to the baby, but these cases have been quite mild and can be handled. And most of the time, it is because of the contact of the mother or somebody who's positive with the baby afterward. And what about pain relief and other things? Epidural analgesia also can be taken, and other injections. Nitrous oxide can be used if COVID might spread to other people with the use of that. Now, coming to the other important aspects, what about the vaccine use in pregnancy? So, if you have had your two doses as prescribed by WHO and Government of India for COVID, either Covishield, Covaxin, or any other vaccine, you are protected. So in England, hardly any patients pregnant who have had two doses of COVID vaccine have needed admission in hospital or ICU care. So that is very reassuring. So a pregnant woman should get protection from the vaccine as early as possible, ideally before she gets pregnant or at any trimester of pregnancy, first trimester, second, third, it doesn't matter. And this will give protection not only to her, but recently studies have come out in US where these vaccines have provided antibodies to the baby as well, and it could reduce the risk of infection to the baby and the severity of COVID in the baby. So it's really important that you get vaccinated. The other thing is whether we normally give tetanus or Tdap and flu vaccine in pregnancy. Should we give vaccine as early as possible and complete your vaccination dose? So as we enter into the so now March of February of this year and so on, the question is whether women require their precautionary dose or their booster dose in pregnancy. This is a question that women are asking quite often. See, as of now, Government of India has not said that precautionary dose specifically is required for pregnant women, but in US and other countries, precautionary doses have been advised, and women are taking this precautionary dose. So, if you would like to take the dose, you're welcome, and it could be any of the vaccine makes that you can take. So, ideally, the same one that you took previously, or any other vaccine make you can take in pregnancy, and that will give you that extra bit of security. So booster doses are also fine, but we are yet to get clarification from the government about that, because as of now precautionary doses are for high risk people with comorbidities, women over 60-year age group. And the other thing is about the high risk groups in pregnancy. So who are the women who should be more careful about their blood pressure, diabetes, or heart disease, especially, or those who are obese? These are the women who should take care, and especially if they get COVID, they have to especially if they get COVID, they have to monitor their saturations at home. And antenatal care in pregnancy when a woman is diagnosed to be COVID positive, should she come to the hospital? So, as you all know, we have extended telehealth, so tele consultation to patients who are COVID positive. So, we urge you not to come to the hospital, especially if you have all these signs now. You know, if you have fever, cold, cough, it's better not to go to a hospital or to a clinic. It's better to consult via telephone or online, and these facilities have been provided. It's better to wait till your 7 to 10 days of quarantine Stay at home, isolate yourself, protect others as well around you. So, if a woman has a, suppose, a very important scan coming up, you have a 20-week scan or a 28-week important scan coming up. So, what do you do if you're COVID positive? So, what you could do is defer it by a week. Generally, the normal scans, the NT scan at 12 weeks, or the normally scan at 20 weeks, or the growth scan subsequently, can easily be deferred. First, you should check that with your obstetrician. Second, try and club all the tests together. So if you have a blood test, so you have a GTT test, or another blood test coming up, or another blood test coming up, you can club that with your scan and your doctor's consultation. So you can write all your questions beforehand and ask and spend minimum time in the doctor's chamber or in the crowded area in the reception. So attenders and are usually not allowed, and we urge you to cooperate with us in this crucial time, both in the doctor's consultation room or the scan or lab or whatever. So this is for your protection and the protection of others. How else can you look after yourself? So, so general precautions. So a pregnant woman is has got exposed to somebody who's known to have COVID. So usual we get queries: how can I look after myself? Is there any precaution I can take so that I don't get COVID? Not really. So this Omicron variant is quite infectious, and if you are to get it, you will get it, and it has so far been quite mild. So best is to look after your health, eat a balanced meal. If you're having capacity and you can take that 3 times a day. If you have a running nose, headache, cough, you can take antihistamines, or cough syrups, which are quite safe. Vitamin C and zinc supplements are also given. To an extent, those can also be taken and they are quite safe. So, any other medication that is required for COVID use of teleconsultation. And to maximize this, what I urge you all to do is you can have a weighing machine at home, a blood pressure monitor, and saturation, and you can check all this and send the reports to the doctor before the start of your teleconsultation, and this you can maximize the effect of the consultation. The other things, so this has been, we cannot underestimate the effect of COVID that has it has had on mental health of people. People are quite anxious, and probably there is so if there's a pre-syndromic anxiety, depression, it is coming to the fore because of all the restrictions because of COVID and their worries about what this would do to themselves and their family. Please talk to friends, talk to your doctor. If you need a counselor, that can be arranged. And you can do relaxation exercises, you can do yoga, you can walk around the house or in your terrace and try and get some fresh air and sunlight. So physically in pregnancy, we do advise you to walk and stay healthy and flexible. Please look after yourself for that. And avoid going to crowded places. Use alcohol rub. So SMS, so social distancing, wearing of masks, and sanitize. So sanitize all the commonly used tables, doorknobs, keys, fobs, everything, and make sure that you keep yourself and your family safe. I can see some questions here. So the first question is, does it lead to complication to the baby? So if somebody is COVID positive in pregnancy, as I said, if it's in the first or the second trimester, so far no complications have been reported. far, it has not led to any problem in the baby. Very rare, and usually this could be because of very rare infection of the placenta or the amniotic fluid or the vaginal secretions. And even then, it seems to be quite mild. And the pediatricians are on the job and they will test the baby and they will give all due treatment or whatever needs to be done. But in this wave, the infection has been quite mild, so that is a relief. So the next question is, how can a prenatal care be modified to decrease the risk of COVID-19? That's a very good question. So the last thing we want is patients coming for their routine visit and getting infected from another positive patient in the hospital, because hospitals do have patients who might be positive. So as I said, in the first 12 weeks, 16, 20, 24, 28, 31, 33, 35, 37, and 39. So you can have a few of these visits online or by teleconsultation, and it is better to club your scans, blood tests, and I assume this is what you mean by this question. So you can you can maximize your visit to the doctor. At all other times you can use teleconsultation. The next question is, how long should mother newborn precautions at home continue after recent infection? So if so normally it's about 7 days, that is extending beyond the 7 days, then that precaution will need to be extended. So this, I assume, is isolating the baby or pumping or using mask and sanitizing hands before and after. Yes. The next question is, can postpartum women with COVID-19 take NSAIDs and acetaminophen? Yes, during infections, we do restrict the use of NSAIDs. We give minimum dose or initially for around 48 hours and restrict the dose, because COVID by itself can cause thrombocytopenia, and that could get aggravated if we use NSAID. So yes, a restriction would be there in moderate or severe infection. The next question is, ma'am, no more questions can be continued. That's not a question. Okay. All right. So thank you very much for this opportunity, and I hope all of you stay safe. And we are almost beginning to see the end of the third wave here in Bangalore, and hopefully all of you will stay safe. Thank you so much for this opportunity.
Thank you so much, ma'am. I will end the broadcast. Thank you so much.
Thank you.